Thanks so much for joining us today at Experience VCC, our virtual open house. We're so happy to have you here. My name is Elizabeth. I'll be your moderator for today. And just a few housekeeping items, if you could just mute yourselves while we proceed through the presentations today. And if you ever have questions at all throughout the presentation, please feel free to put them in the chat box, and we will have a Q&A session a little bit later today. Or if you are unable to type in the chat box for any reason, please raise your hand and we'll get to you. Okay. So before we actually dive right in, I quickly want to acknowledge that we are working on the unceded territory of the Coast Salish peoples and the traditional home of the Squamish, the Musqueam, and Tsleil-Waututh people. So you're going to hear from a series of presentations today from some of our staff who cover some of the different healthcare programs today. And then we'll go into questions. You'll hear from an advisor. And please, by all means, stay until the very end, because we'll have some promotional codes for you to get some discounts and a chance to win $1,000 towards your tuition. So that's very exciting. All right, and if you ever need an interpreter, please mention that in the chat box and we'll get one for you. Okay, so Q&As, of course, feel free to put them in the chat box. I want to start off with a little poll just to get started here. And I'd like to know, when are you considering starting a program at VCC? I'm just going to let the answers roll in. There's a couple people joining us. Got 24 answers so far. If you are just joining us, there is a poll up on the screen. Okay, I'll share the results right now. 25, here we go. All right, so that's pretty exciting that a lot of you are looking to start this year. A couple of you possibly looking to next year, the year after, and unsure. So hopefully we'll be able to answer some of your questions if you are unsure. We have an advisor here to tell you all about how to maybe get all of your requirements lined up. Okay, so that's great. So the first program we want to start off with the presentation today is the Acute Care for Healthcare Assistants and the Healthcare Assistant Program. And for that, we have Lisa Beveridge here today to talk about that program. And I'll pass the floor over to you, Lisa. So go ahead.
Hello, my name is Lisa Beveridge. I'm the Department Head of Continuing Care, supervising the Acute Care Program for Healthcare Assistants and the Healthcare Assistant Program. You can go ahead and switch slides. Oh, never mind, go back. Okay, so the Acute Care for Healthcare Assistant Program is a program for people who are already working as healthcare assistants. So to get into the program, you need to already be a healthcare assistant with 800 hours of work experience as a healthcare assistant in a complex care facility within the last 3 years. And so the acute care program builds on the experience and the knowledge from the healthcare assistant program and allows you to work in the hospital, which is known as an acute care setting. This program is 4 months long and runs in a part-time capacity, so running on Wednesday and Thursday evenings for classes, and ends with a 2-week clinical, which occurs in daytime hours, so 7 till 3. The next available offering of the acute care program is in the middle of October of this year. And applications can go to the registrar's office if you're interested in that. Again, you'll want to check out the website Just to confirm the admission criteria, again, you have to have the 800 hours of work experience as an HCA. The other program that I supervise is the Healthcare Assistant Program. The Healthcare Assistant Program is an 8-month-long program that trains you to become a healthcare worker, working in traditionally long-term care areas, focusing on clients that are elderly or clients with physical challenges or developmental challenges. Healthcare assistants help patients and clients do a lot of their own personal care. This can include getting in and out of bed, using the bathroom, getting their bodies washed up in the morning and before bed, oral care, getting dressed, eating, walking and bathing and showering. So it's a personal care role within the healthcare assistant. And again, it's 8 months. We run this program 3 times a year, so January, May, and September. May is full though. There are no available seats going into the May class, so registration would be available for the September cohorts. There are 2 September cohorts. There's the regular HCA stream, and then there's the ESL HCA stream, which offers some additional English language support. And I'm happy to answer questions later about the specific English language requirements for each of those programs. But the regular program is 8 months and the ESL version is 10 months.
Perfect. Thank you so much, Lisa. And again, I'm sure there's a lot of questions about this program, so please feel free to put them in the chat or we'll answer them later on in the Q&A section. All right, so the next program we would like to share with you today is the Medical Device Reprocessing Technician program. For that, I have Rebecca here to present this to you. So Rebecca, take it away.
Thanks, Elizabeth. Hi, everybody. My name is Rebecca. I'm the program coordinator for the Medical Device Reprocessing program at VCC. So medical device reprocessing is a unique healthcare career in which students, in this program and when they do this type of work, students receive specialized hands-on training to reprocess reusable medical devices such as surgical instruments, patient care equipment. Students learn to decontaminate and disinfect reusable surgical instruments. They learn how to check them over to make sure that they're in working condition. They learn how to put the surgical instruments back together for another surgery, and they learn how to sterilize the surgical equipment and instruments, and then finally they learn how to store the equipment. So the medical device reprocessing departments are usually on the bottom floor of any hospital, and the department is considered the heart of the hospital. So without MDR technicians, there could be no surgeries. There could be no ears, eyes, and nose clinics. There could be no eye clinics. So really all of the different areas in a hospital, they really depend on medical device reprocessing technicians to make sure that any instruments and any patient care equipment that is used between patients is safe, sterilized, and ready to be used between patients. So this program has a focus on infection prevention and control and ultimately patient safety. So if you want to work in a healthcare setting, but you're not really interested in working directly with patients, then this is a great program for students who want to work in a hospital, but they're not really interested in working with patients. So the MDR technicians work behind the scenes, but ultimately they're part of a big team to make sure that the patient's safety is priority. The thing about the VCC program, is that it's the only college, VCC is the only college in the Lower Mainland that offers this type of specialized training for MDR technicians. The closest college that offers this would be on Vancouver Island. There's a couple in the interior. So because of that, the managers in all of the hospitals come to VCC to hire MDR technicians. So I work directly with the managers of the local hospitals, about 6 hospitals that we partner with, and they know exactly when we're starting the program and they know exactly when they're ending. And the managers wait until the end of each intake to hire the majority of their technicians, and they do that twice a year. So basically, the students come to VCC, they learn how to become MDR technicians, and then the managers are waiting at the end. Usually the students are interviewed before the end of the program, and they can get jobs within about a month to 3 months. I would say about 95% of our students are successful in getting employment. So they get employment within about 1 to 3 months. Some students go on to do different things. They go on to work with suppliers who manufacture and supply the reusable equipment. The other thing is, because of COVID right now, there is an increased demand for MDR technicians. So there's always been a very, very high demand for MDR techs, but because of COVID and all of those surgeries that were postponed and they weren't scheduled in the first 6 months, are now being rescheduled. So when you have a ton of surgeries scheduled on top of the usual ones, then there's a need for more and more and more MDR technicians, because with more surgeries, that means more surgical instruments are being used, and that means they need more people to make sure that they're clean, sterilized, and ready to go. When students finish this program, they get hired as casual technicians. So they start casual, they get a shift differential, they get, a certain percentage of their wage. They get an increased wage in lieu of benefits. It takes about 6 months to a year for technicians to become full-time. And when they become full-time after about a year, then they get all the benefits. The program itself is only 4 months, so it's nice and short. So students get in and get out within 4 months. They, like I said, about 95% have jobs within about a month or two of finishing the program. It's a full-time program. It's fairly intense. It's Monday to Friday, full-time during the days. There's some evenings. The program is structured in a way that there's 1 month theory followed by about 3 months practicum. So the majority of this program is hands-on in the hospital. So students have a really, really good experience actually doing the work so that they're confident when they finish the program. And the sites that we work with include VGH, St. Paul's, BC Women and Children's, Surrey Memorial, Royal Columbian, and Abbotsford Regional Hospital. So that's where we send our students to. And then the program starts in January, May, and September. Thank you.
Perfect. Thank you so much for that extensive overview of this program, Rebecca. Very, very cool. Very essential job as well in the healthcare field. And this, of course, I hear is expanding as technology evolves. So thank you very much. All right, the next program we'd like to highlight is the Medical Lab Assistant Program. I'm going to ask either Domingo or Heather to take this one on.
Okay.
Hi,
so I can talk about briefly. I know Heather's. Is Heather here? Hello?
I think I'm someone else.
Okay.
Oh,
thank you so much, Domingo. If
so
you
I
can
can
on the
sure.
requirement.
I can talk about the medical lab assistant. So this program is actually designed to prepare students for employment in either private hospital or public health laboratories. So this program consists of a combination of theory for testing and analysis, and practice safely, ethically, and professionally as a medical laboratory assistant. So they also provide administrative functions to support the operation of the medical laboratory, and that will be discussed during your program. Students also learn how to perform cardiac monitoring tests, including electrocardiograms and Holter monitoring, and they assist with quality assurance programs in the medical laboratory. So this program is quite intense. It's only 6 months, and it's a full-time program, Monday to Friday, and we have 2 intakes, May and September. Like any other programs, we do have program admission requirements, and I can talk about that later. It's very, very basic, but you need to, if you apply to the medical lab assistant program, you need to meet our program requirements. And as I said, you need to, we'll discuss that later on during the FAQ. Yeah, that's about it. There's no wait list, and there's no deadline to apply for this program. However, seat offering to the medical lab assistant, like any other programs, for example, in HCA and acute care, is actually first come, first qualified. So please understand that even if you apply to an actual intake, that does not guarantee that you're going to get in, just because, again, seat offering is first come, first qualified. So in other words, you need to have all your requirements. Okay, there you go. Thank you.
Thank you so much.
Okay, there you go. I saw a question, but I can answer that later on. There you go.
Perfect. Thank you. All right, up next, we would like to invite Carmen to talk about our Occupational and Physical Therapist Assistant Program. Carmen, over to you.
Great, thank you very much. So my name is Carmen. I'm the program coordinator for the OTA PTA program. It is a 2-year full-time program. We have one intake each September for approximately 20 to 22 students. Our program is accredited across Canada. So once you graduate, you can move anywhere in Canada to work. It's a very hands-on practical program. And it also contains 17 weeks broken into 3 blocks of practicums in the hospital. So we set those up for you, and you are partnered with a physiotherapist or an occupational therapist to do all of your clinical practice in the hospital. So when students graduate, they typically work in acute care hospital or residential care, or possibly a rehab center like GF Strong. They work in the medical team with OTs, physios, social workers, dietitians, nurses. So they're an integral part of the team. Another place that's really expanding the role of rehab assistant is in the community and in mental health. So those are 2 kind of exciting areas to work in as an occupational or physical therapy assistant. So typically we work with people who have experienced some form of disability or illness. Perhaps a person may have had a stroke, and we need to, and only have the use of one arm and one leg, and so we need to teach them how to redress, how to be able to dress themselves independently. So we might do that. If a client has had a spinal cord injury, we would teach them how to move and get around in their wheelchair. So there's lots of different opportunities for clients, for people to work really directly with people who have experienced significant illness or disability. It's a very good job market right now. We just had a graduating class on last Friday, and I would say 3/4 of them are already working this week. So there's a big push for hire in the healthcare industry, so that's great. We also set up, I saw one of the questions earlier was, we also set up like a job fair. We have the recruiters come from all the different health authorities to recruit our students. So we did that this year, and recruiters came from all over BC via Zoom to recruit the students for work. So it's a very good job market out there right now.
That's really exciting. Thank you so much, Carmen. All right, and last but not least, we have Jennifer, who's here to talk about our pharmacy technician program, also really exciting. So Jennifer, it's on to you.
Thank you. So my name is Jennifer. I'm an instructor for the pharmacy technician program. So our program prepares students to work as licensed pharmacy technicians. In the pharmacy profession, pharmacy technicians primarily focus on the preparation and distribution of medications to patients. So this might include procuring inventory, filling prescriptions, making IV medications if you're working in the hospital, or compounding creams and ointments. You might also spend time teaching patients how to use different medical devices. The pharmacy technician is an important member of the entire pharmacy team, which may include some assistants or pharmacists. And they all work together to make sure that the patient receives safe and effective drug therapy. To work in the pharmacy profession, technicians need to be licensed by the College of Pharmacists in BC. And the purpose is to make sure that all the pharmacy technicians are safe and competent to practice, and this helps ensure that the public is protected. Graduating from our program is the first of several steps to get licensed. After graduation, there's a provincial exam, a federal exam, and then a structured practical training program that is 160 hours. Our program consists of 14 courses spread over 3 semesters. It's full-time for 30 weeks or 7.5 months. Semester 1 focuses on if you were going to work in a community pharmacy, such as Safeway or London Drugs or Shoppers Drug Mart, and a little bit on long-term care pharmacy practice. Semester 2 focuses on if you're going to work in the hospital, so Lionsgate or VGH or St. Paul's, and also the preparation of sterile products in the hospital. Semester 3 is a practicum. You'll do a couple weeks at a community pharmacy and a couple weeks at a hospital pharmacy. And then throughout the program, there are dispensing labs, compounding labs, and sterile labs so that students can practice what they learn in the classroom in a simulated pharmacy setting. To work in a pharmacy, it's really important to be organized, focused, and have a good eye for detail. This is because the pharmacy technician has a lot of responsibility in checking that the product that is going out is correct and accurate. They are the last person to check before the patient uses the medication. So we have to be 100% accurate to make sure that there's no harm done to the patient. Our program is busy and challenging, but it's very rewarding, and it leads to a great career in healthcare.
Excellent. Thank you so much, Jennifer. All right. So now that we heard a little bit about a couple of our programs, and these were all very brief overviews. If you want to get to know them more in depth, we have a few upcoming info sessions happening this month and next month. So if you want to dive a little bit deeper into the occupational and physical therapy assistant program and learn more about the ins and outs of the program, there's one actually happening tomorrow at 11. So please sign up online at vcc.ca/info, and we'll send you the Zoom meeting link once you sign up. We also have the MDRT happening this month and next month. So again, same process, sign up online to receive the meeting link. And you just heard about the pharmacy technician program. So if you want to learn a little bit more about how classes are being run and so on, job prospects and all that, please sign up again, same place. All right, and now what are the next steps? So here we have Domingo, who will kindly present to you what it takes for you to line up all your admission requirements and questions you might have about that. So Domingo, up to you here.
Hello everyone, and thank you for attending our Experience VCC info session for health programs. Like any other programs at Vancouver Community College, I always encourage everyone to apply online and then email your documents to ro@vcc.ca. Major commonalities applying to this program is obviously you need to submit your transcripts, noting of grade 12 graduation or equivalent. We look at English 12. Again, commonalities of this program is we require English 12 with a B or equivalent. If English is your second language, on top of the English 12 with a B or equivalent, you are also required to submit or to take English language proficiency. The English language proficiency could be IELTS academic, or our ESL pathways, completion of our ESL pathways, level 8 in all skills. Exception for the pharmacy technician, you are required to take a reading and writing assessment in VCC. even though English is your first language. So you are required reading and writing English language proficiency tests at Vancouver Community College in person. However, because of COVID, you're not allowed to take the reading and writing exam. I'm talking about the pharmacy technician here. We're giving the option to take the IELTS academic for those people whose English is their first language, only for pharmacy technician. For the other programs, healthcare assistant, specifically we require Canadian language benchmark placement tests, or general training IELTS, or academic IELTS as well. I'm pretty sure Lisa will also talk about English language proficiency as she mentioned during her presentation. And if you do have questions later on, please ask. I also encourage everyone to book an appointment and speak to the academic advisor. I'm going to give you that information in the chat box later. You can also book a phone or Zoom appointment. We do have drop-in every day for only 15 minutes, and that happens obviously Monday through Fridays, and usually I do drop-ins as well. There is a drop-in today happening till about 5 p.m. So after this presentation, if you do have questions, please attend or participate in the advising room info session again until 5 p.m. today. I'm pretty sure one of our techies here will provide you with the link so you can participate. Yeah, there you go. Again, I encourage everyone to apply to the program and submit all your documents to ro@vcc.ca. Again, there's no wait list to get into the program. There's no deadline to apply to the program. However, seat offering to the program, or any of the program for that matter in health programs, is first come, first qualified. There you go. Thanks.
Perfect. Thank you so much, Domingo. Very important information provided to you there. And yes, Fiona has kindly provided you with the link to the advising room later on that you can join up until 5 o'clock today. All right, so please book that appointment if you need to talk more about your admission requirements. Now, I've seen it's been pretty busy in the chat box, so we'll take a few questions. We'll try to get in as many as we possibly can. So Fiona, who's been helping me here, if you don't mind just taking a look and seeing, are there any questions that we can go over that haven't been answered in the chat box?
Sorry, just give me a moment. My computer's going a bit slow.
There's a question here from Kimberly Bowen. Is nursing available to international students? So I'm assuming it's the RN. Unfortunately, we're not offering this to international students yet.
Okay, perfect. Thank you. Okay, so I'll take one here. How does VCC define physical stamina that qualify applicants for the healthcare programs? I think this one's for Lisa.
Physical stamina it's not a specific metric. It's more about just understanding what the job entails. So being a healthcare assistant involves helping other people get out of bed. Sometimes that involves the use of equipment, but a lot of the time that involves the use of your body helping somebody else to stand up. Now, we'll teach you all the proper body mechanics and strategies for how to do that in a way that doesn't result in injury to your body. But it can be a more physical role. You know, when you're helping people to sit up in bed, to get out of bed, to get dressed, to shower, you're using your body to do those things. So there's a lot of movement, a lot of squatting, a lot of helping people walk around. And so there's no like specific criteria like there might be for being a firefighter, but it is important to understand it is a physical role. It's not per se like another healthcare role where you might be primarily speaking or interacting verbally with residents. You are primarily interacting with your clients in a physical capacity, helping them physically do the things that they are unphysically able to do. So if you have back injuries or mobility limitations, it can be very difficult to accomplish the role in a way that doesn't result in a negative strain on your body.
Very important. Okay, thank you. This is another one probably for you, Lisa. This is from Tracy. So she is commencing the HCA program, and for the clinical test, she's asking, do we use mannequins or actual people? And are you able to say which facility where the community practicum is being held?
For the lab testing, we are using mannequins. We traditionally practiced and tested on other students, but right now, due to COVID, we are using mannequins. For the clinical component, you will be interacting with real people in long-term care facilities, so you'll be taking care of elderly people directly. For the clinicals and the practicums, practicums and clinicals occur throughout the Lower Mainland. Now, as Vancouver Community College, they tend to primarily occur within Vancouver, Richmond, and Burnaby. However, due to COVID and COVID outbreaks, we've had to be more flexible with our placements, as we don't send students into facilities that have COVID outbreaks. So that has pushed some of our placements into Surrey and the Tri-Cities area, and pushed them a little bit further out.
Perfect. Thank you. Thank you so much. Here is a question from Jennifer, and it's for the OACP. Do I have to take OACP 1108 Medical Terminology 1? And these are classes, MSKL 1104 Interpersonal Communication Skills before I apply or before the program begins?
I can answer that one. So this is in regards to medical device reprocessing. So yes, those two courses need to be finished before a student starts the program. However, students can apply to the program without having taken those courses already. So you can apply and then take the courses after you apply.
Thank you. All right, I have a question from Gurjeet, who is an international student. What is the English requirement for someone who's already an HCA? He has a bachelor degree from India.
When you say international student, what does that mean? Does she have a? I just want to make sure that I'm going to be answering her accurately.
Would you like to unmute yourself and maybe ask the question?
Oh,
excuse me. She like Canadian permanent resident, but studied in India, like Bachelor of Science.
Oh, okay, gotcha. Now I'm clear. So she's currently in Canada, and she's permanent resident, right? So in other words,
she is living for 10 years.
Okay, gotcha. So
and she did HCA from the school at Surrey, like I don't know the name exactly the college, but she did from Surrey College, HCA, in 2017.
So what you're saying is she studied healthcare assistant in Surrey, correct?
Yeah.
Okay, so my
question. Pace College, Surrey.
Okay, but what does she intend to do at Vancouver Community College? Does she want to continue her studies at Vancouver Community College?
She want to do MDRT.
MDRT, the Medical Device Reprocessing Technician. Well, if that is the case, she has the option to take the Duolingo English test, and I can send you that information via chat. Duolingo is the best bet for her, just because it's cheap. It's not really cheap because you have to pay, I believe, $77 US or $79 US. But right now, because
Okay.
of COVID, that's the only option. I mean, she can also do IELTS academic, but IELTS academic is very, very expensive. It's like 300 US dollars, and I don't really recommend to take that test. So right now, Duolingo English test is her best bet. And if she gets 110 or better in her score, she is perfect to take the MDRT. Now, here's the thing: if she doesn't meet the score, the 110 or better, the only option she has to do is to take our English ESL pathways, and she needs to complete level 8 in all skills.
Okay.
And as I
And
said,
you
I
can
can
send me email. I already put in the chat box email. I am
I can
Sundeep K.
yes, I can
Uh,
actually send you all the information you need.
okay.
Do I just want to make sure that we have that email address from Mr.
Yeah, I
Sen.
have already sent. I am Sandeep SANDIPK at gmail.com.
Okay, hold a
So,
second.
Gurjeet, what I'll get you to do, just because we want to get through more questions here, how about
Yeah.
I get you to email Domingo? Domingo, if you can provide the advising at VCC.ca, and then you can get in touch
Yeah.
and work it out that way. But this is great. Thanks so much for asking this. This is really important. All right. I do have a question from Ko about healthcare networking opportunities and jobs, which we touched on. So I hope that did answer your question earlier during the presentation. And Mary Grace is asking, is HCA offered for international students by January 2022? Anyone?
What was the question again?
I
Yes.
believe, yeah.
She's asking if there is the HCA
Healthcare assistant?
program, healthcare assistant, is it being offered for international students by?
Not that I know of, but I suggest that to contact our international office by email, and the email address is study@vcc.ca.
Do you mean for international students for the HA program in a capacity in which would have the person not present in the Lower Mainland? Or just as an international student who's come to the Lower Mainland?
Mary Grace, would you like to unmute and clarify? If not, you can always put that in the chat box, but I'm going from top to bottom right now. So here's another important question from Karen, who's asking, I noticed on your website it's preferred to be fully vaccinated. She is a mature student and she's not sure which vaccine she's received over the years. So is it mandatory to be accepted into the healthcare programs?
I can speak to that one for various healthcare programs. So first of all, if you don't have your records, then you can take the health sciences immunization form to a walk-in clinic or a public health office. They will review the information you are able to provide. They will send you for a blood test. They will test your immunization levels, so the degree to which you are immunized against various infectious diseases. And they will send those results back to the person who ordered them. So either the walk-in clinic or the public health office where you started. Mm-hmm. If you require any booster shots, so then you can get those booster shots from the person you started with. Again, if you started at a walk-in clinic, you go back there. If you went to public health, you go back there, and they can give you booster shots for your immunizations. Immunizations are not mandatory. However, students are guests in healthcare facilities. So while the college cannot mandate that you are vaccinated, the healthcare facility where you do your clinicals can deny you entry if you are not vaccinated. And that can be individual from healthcare facility to healthcare facility. and experience to experience. So it is a risk the student takes if you choose not to be vaccinated, that you might be denied entry to do the practical portion of your program.
Thank you so much, Lisa. That's really important. Okay, Kimberly asks, what healthcare programs are available to international students?
My only answer to that is please email study@vcc.ca.
Perfect, thank you. And that is the email for any international inquiries.
Yeah.
So please email that. And Jennifer asked, for MDRT, is there a way to apply through the Education Planner BC instead of the PDF form?
I'll answer that. Yeah. So for MDRT, all applications need to be done through continuing studies because it is a continuing studies program. The application can be found at the bottom of the MDRT webpage on the VCC website.
Perfect.
It's a PDF form, fillable PDF.
Okay, thank you. Lally is asking, I've passed Pathway 8, reading and writing, and Pathway 9 for listening and speaking. And she's a foreign graduate in the medical lab sciences. Her credentials are evaluated by ICES as a bachelor degree. Is she available to apply for the medical lab assistant program?
Well, you know what? Yes, that is the medical lab assistant only requires grade 12 graduation, right? If she has a degree, then that's it. I mean, that can be an equivalent. That should be an equivalent, rather, should I say? But on top of that, she still needs to submit, grade 12 English, grade 12 English with a B or equivalent. So the equivalent could be Duolingo English tests or IELTS academic. I suggest that for this person to email advising, just because, in this info session we're talking about different programs and we don't want to overwhelm participants with so many information, especially English language proficiency, because they all varies. For example, HCA requires different, specifically requires a Canadian language benchmarked or IELTS academic or general training. Pharmacy technician requires specifically IELTS academic, right? For people whose English is their second language, and for people whose English is their first language, they are still required to take the reading and writing assessment in person at Vancouver Community College. So there's a lot of permutations as far as English 12 with a B and English language proficiency are concerned. So I suggest that they book an appointment and speak to an academic advisor. We just want to make sure that we're giving the right information. There you go.
Perfect, thank you. And here's one for the pharmacy technician program. So if you complete the pharmacy technician program and get all the licenses required, will you be able to work in any province in Canada?
So for the pharmacy technician program, you're registered to work in BC only. If you move to another province to work, they may have another provincial exam that you would have to take when you get there.
Okay, perfect. And just one more for you, Jennifer. So where are the pharmacy technician practicums usually held at?
So our practicums are held all over the Lower Mainland. We use various Safeways and Shoppers Drug Marts for the community practicum. And then for the hospital, we're in Lionsgate, VGH, St. Paul's, Richmond, Royal Columbian, Burnaby, all over.
Perfect, thank you. So I do have a question about how you can get your application fee waived. I will touch on that just a little bit. There is a slide with the codes that you can get and some door prizes as well. So I just want to get through a couple of questions here. Is the occupational and pharmacy tech programs, are they already full for the 2021 year?
That's a good question. As an academic advisor, I always suggest to prospective students to apply to the program online, just because you don't know there's a lot of people applying to these programs. However, they're not submitting the requirements, and I kept on saying seat offering to these programs is first come, first qualified. So what does that mean? It means we're not going to offer you a seat, even if you applied, if you're not, meeting all the requirements. So I suggest that everyone to apply to the program online and submit their documents noting meeting our requirements. And all you have to do is just wait for your acceptance letter, because you may never know, you might get an acceptance letter 3 months or 4 months later, right? So it's not hard, because it's easy to apply, and we are also waiving the admission fee today should you wish to apply today. And I believe until when is the deadline to waive the admission fee?
The deadline to waive the admission fee is until April 30th. So
there you go. Yeah.
Okay. All right. I see a couple of questions being answered here, so this is really great. Are the classes at this point going to be online? For the LPN and pharmacy technician especially?
At this time, we don't know. Our current program right now is being run as a blended program. So we have Zoom lectures in the morning where we cover course material and have discussions. In the afternoon, students are either working at home on assignments or projects, or they're on campus in small groups doing labs. And students are on campus doing labs maybe 2 or 3 times a week. Practicums are running as normal with proper PPE and COVID safety protocols.
Thank you so much, Jennifer. Okay, I see a couple of questions here being answered in the chat. So I'm gonna take a look. Has anyone's questions, because there are quite a few it's going on, which is awesome. I love it when there's questions. Has anyone haven't had their question answered yet? And would you like to unmute or raise your hand so that we can answer it?
Hi.
Hi.
I was just wondering, I'm not sure if it got answered because I got kicked out and I just came back in, but I was just wondering for the healthcare assistant, the part-time program, how does that work? And how, when applying, how are usually the applications for that program? Is there a wait, or is it like, should we apply it as soon as possible, or?
The part-time program for the healthcare assistant program will not run this September 2021. The regular full-time programs will run, but there are additional HCA programs that the government is running right now that are a co-op style program. So in addition to our regular full-time programs, which are the 8-month regular programs or the 10-month ESL, we are also running HCA co-op style programs, which are a blend of learning and working for the elderly.
That's the government program, correct?
Sorry.
The blended is the government program for the BC government is offering.
Yeah, that's a blend of working and that one's about a year. So in place of the part-time program, we are running these blended and it's not blended for like online learning in person. It's not that type of blended. It's blended in terms of working and doing school. So it's a co-op style program. So the department is running multiple additional co-op style programs this year, and so we'll not be running a part-time program. Now, if you're just wanting to take the full-time HCA program, get it done in 8 months, no co-op style learning, then you would apply directly to the college. If you are interested in the government co-op style program, which will take about a year, then you need to apply on the government website for that program. It's called the Health Career Access Pathway. And so we are doing that this year in place of a part-time program. We will run another part-time program later in 2022.
Okay, thank you so much.
Perfect, thank you. Has anyone else have not had their question answered? And if so, please raise your hand or unmute.
There's a question here. I don't know if this has all been answered. Is biology mandatory for PTA? I guess this is for the OPTA. Yes, it is. We require biology 12 with a C+, and it has to be within the last 5 years. So there is an expiration. Again, biology 12 with a C+ or higher, completed within the last 5 years. And this is for the OPTA program.
Perfect, thank you. Someone, Pinder, is asking, you took a medical terminology class at Camosun College. Does that work to transfer?
Does that work towards the OPTA? Because the OPTA requires completion of a medical terminology course with 70%. I think Camosun is fine. It's okay. I think and Carmen can also confirm, but we require 70% or higher.
Yes, I think that would probably be fine. The one at Camosun College, I can have a look at it.
Yeah, perfect. And we just so you know, I don't know if Carmen also mentioned this in the in her presentation. I believe we are also waiving the 50-hour volunteer experience for the OPTA because of COVID.
Yes, we are. Yeah, we're waiving it for this September again. It's just too hard to get the volunteer hours.
Yeah, perfect. There you go.
Perfect. Thank you so much.
Mm-hmm.
Okay. If you have any further questions, please feel free. The slides will be presented to you at the end of this session, and you will be able to email all your questions as well to each of the separate program of interests. So I do want to share with you a couple more slides. Yes.
Sorry, I just want to make mention very quickly. For the medical lab assistant and for the pharmacy technician program, both programs, just so you know, require keyboarding tests. There's a good news right now for taking the keyboarding tests because you can do that now in person at Vancouver Community College. However, you need to email our assessments office, and I'm going to put that email address in the chat box because right now, although we are open for keyboarding tests in person, you have to schedule because we want to make sure that we are following you are following safety COVID protocol. Okay, so I'm going to put that in the chat box. Please email assessments@vcc.ca.
Perfect. Thank you so much for bringing that up, Domingo. Yeah. Okay, these were all really great questions. I really enjoyed this discussion. I just want to touch on a couple more things before I leave you with the waivers, tuition waivers today. So as a VCC student, you do have access to advising services. You've heard from Domingo today. There's a team of other ones as well that you have access to. There are certain scholarships and bursaries available to you if you do enter the healthcare programs. So please go to vcc.ca/financial aid for that. And we do, if you are an Indigenous student as well, we do have a couple of offerings, seat offerings for Indigenous students. And we do have elders and other services available to you as well to create that safe space for you.
Another important thing that I want to share is, with exception of acute care for healthcare assistants, MLA, OPTA, Pharm Tech, MDA, what is that? Medical device reprocessing technician, HCA, ESL, they're open for student loans. So in other words, you can apply for a student loan. However, the only time you can apply for a student loan is when you receive the acceptance letter. Okay, so only when you receive the acceptance letter, that's the time you can apply for a student loan. Don't be applying for a student loan if you haven't applied yet or you haven't been accepted to the program, because that's not going to work.
That's an important distinction. Thank you so much for sharing that.
Mm-hmm.
All right. And if you are in need of interpreters, you have a disability and you need access, we do offer disability services as well. Counseling, of course, if you are having a hard time at school and would like to talk privately one-on-one, we have that, and professional tutoring as well that is available through our library and learning center. All right, so a couple of next steps once you've attended this session. If you would like to know more in depth about the programs, please attend an information session. Again, the link to that is vcc.ca/info. You can then meet with an advisor, and they're here until 5 o'clock today to make sure that you have all your requirements. And if you are ready to apply, please go ahead at vcc.ca/apply. And now for the waivers. So if you are a domestic student, we will be waiving the $35 application fee. That is, you go to vcc.ca/apply and the promo code is info0421. So that's the promo code that you will use to waive this application fee. And of course, we have some door prizes. So if, this is a great one we love to give away. So there will be 3 winners out of all the attendees over the yesterday and today who will get a chance to win $1,000 towards their tuition. So if you would like to be one of those winners, please go to vcc.ca/experience. The code is skills. So the more sessions you do attend, the greater the chances of winning. So that's just something to know. Okay, it was a pleasure to meet with you today and to answer some of the questions you have about our healthcare programs. I hope you took away a lot of information to make a decision. And of course, all of us here are available to answer any questions you might have, for example, advising or by email address. All right, now take care. If you do still have questions, of course, please feel free to ask them with the email that we've provided. Fiona has kindly put in a survey that you can provide feedback, and there's a copy of our presentation slides here as well. Okay, well, have a good rest of your afternoon and take care. Bye, everyone.